late 1990s, Dr. Moses Sinkala, the then District Director of Health for Lusaka District, reached out to Dr. Stan Vermund, a professor and director at the John J. Sparkman Center for Global Health at the University of Alabama. They, together with Dr. Robert Goldenberg and Dr. Jeff Stringer, both obstetric gynecologists from the University of Alabama, founded CIDRZ.
In 1998, there was a consultation between a group of individuals from University of Alabama at Birmingham and leaders in the fight against HIV/AIDS in Zambia. We had a 2-day conference, which was very much an effort to say what kind of research was needed to help Zambia progress in the fight against AIDS.
CIDRZ was signed up to Memorandum of Understanding with the Ministry of Health through the University of Alabama to assist with activities that ordinarily would be carried out solely or exclusively by the government. And so CIDRZ became an appendage, if you like, for the government through the Ministry of Health to assist working in government health facilities across the country.
And as you can imagine, it was a series of very pragmatic research questions: how to deploy drugs more effectively for therapy, how to enable prevention, how to accelerate vaccine development. And by 1999, we had an agenda that we were writing grants to international agencies. And by 2000, we were funded to do work to prevent mother-to-child transmission.
The PMTCT program started as a study in 2000, where we're only giving single-dose nevirapine to the mother at the onset of labor, and the baby would receive a single dose at delivery.
And I think that CIDRZ has been at the forefront of having Zambians develop solutions to Zambian problems that can be implemented in the Zambian setting.
We were the first people to describe that. At the time, there were conversations around, Africans, can't take ART. It's too difficult for them. So you can imagine in that scenario to come and put ART in a primary care setting, it was unheard of. So we published the first papers and everybody was blown away. And not only that, it gave other African countries the confidence to say, we can do it. And also with children, I'm a pediatrician by training. It was having great outcomes in pediatrics was not really very well documented.
And at the time, that was sort of the height of the HIV/AIDS pandemic. Things were really, really terrible. And so the job was to really get the PEPFAR funding and change that from kind of a concept to reality and focus on implementation on the ground. And that was the beginning of the rollout of the antiretroviral therapies and getting this life-saving medicine out into the country.
Slowly but surely, we were able to offer prevention of mother-child transmission through nevirapine, one of the antiretroviral drugs, to all of the 26 clinics in Lusaka at that time through the Lusaka Urban District, which was directed by Dr. Sinkala. And the 10 birthing centers and the UTH Center all were able to offer this. But the very first nevirapine that was brought in was brought in by us, by CIDRZ, to try to stem the tide of pediatric HIV, which was so devastating at that time.
You can see that the number of new infections amongst babies born to HIV-positive women has reduced, and that has been a big impact. Over the years, a number of individuals on HIV treatment has increased, so more and more people are accessing treatment, and then the number of babies born to HIV-positive numbers that are getting infected with HIV has also reduced.
I think CIDRZ's contribution has really been significant. Some of the numbers which are impressive, the number of people dying from HIV over the last 20 years has been reduced by 70%. The number of new cases of HIV has been reduced by over 50%, and the number of new cases of TB and HIV has also been reduced by over 50%. So, the last 20 years has really seen a sea change in the healthcare system, how the healthcare system cares for chronic disease, and with really dramatic results. Clearly, there's still a long way to go, but I think CIDRZ's contribution in the last 20 years has been significant.
Today, CIDRZ is the largest independent Zambian public health organization. Over 1,000 Zambians work with CIDRZ every day to collaborate and strengthen the government of the Republic of Zambia.